Hello everyone, it's Dr. Fox, and let's talk about the renal fascial spaces. In this video, we'll describe the relative positions of the kidneys within the retroperitoneal space, with an emphasis on the perirenal and pararenal spaces. So the kidneys sit within the abdominal pelvic cavity, posterior to the peritoneum, in what is known as the retroperitoneal space. So in order for one to get such a pristine view of the urinary system, the gastrointestinal organs must first be removed, and then the peritoneum must be stripped away from the posterior body wall. When that happens, you'll be able to visualize the kidneys, you'll be able to visualize the abdominal aorta in the inferior vena cava, the ureters, and if you go down far enough, the urinary bladder as well. Now, in this view, we can see that typically the left kidney is going to sit a little higher than the right kidney, although that is not as evident here owing to the misposition of the right kidney. Typically, the superior pole of the left kidney is at about the 11th thoracic vertebra, whereas the superior pole of the right kidney is at about the 12th thoracic vertebra. The hyla of the kidneys can be found along what is known as the transpyloric plane. If one were to imagine the stomach, just to kind of draw this in, and the pyloric part of the stomach going into the duodenum, that pyloric part would sit just at that transpyloric plane. That's at about the level of the first lumbar vertebra. And if you were to kind of approximate that, you would go from about the jugular notch down to the pubic symphysis, and you would take about the midpoint. That's approximately the transpyloric plane. So that is where you're going to have your renal veins, your renal arteries, and the renal pelvis. Now, what isn't as obvious from this photograph, but you can still kind of tell, is that the aorta and IVC are more anteriorly situated, and behind them is the vertebral column. And so as a result, we have these areas that we call the paravertebral gutters into which the kidneys lie. And that's why the lateral borders of the kidneys are facing posteromedially, which we'll see. Now, despite being well surrounded by layers of fascia and adipose tissue, these kidneys can still move somewhat with respect to ventilation. So as the diaphragm is being displaced, the kidneys may also move slightly. They're also acted upon by the force of gravity. So let's take a look at their position within the retroperitoneum. And we're going to have to take a moment to explain what's going on here. So first of all, to orient yourself, there's the spinal cord. There is a vertebra that is surrounding it. So that would be lateral. And specifically, we'll call this right lateral because this here is a little bit of the liver. We could also see the walls of the thoracic cavity, those ribs and intercostal spaces. I guess at this point it's below the diaphragm, so we're looking at the wall of the abdominal cavity. We can see the deep back muscles, so this is posterior, and we're looking at an inferior view. So there is the IVC and the abdominal aorta. So let's clear this. If we look within the abdominal pelvic cavity, we see that there is a serous membrane called the peritoneum. Serous membranes have two components, a visceral component, and that would be adhered to the liver here, and a parietal component, which is adhered to the wall here. Now, everything posterior to that parietal peritoneum is the retroperitoneal space. And there are quite a few elements of viscera and neurovasculature in that space. So one of which, in this image, is the kidney. And so this is a right kidney. It's contained within a renal capsule. And we could see that there is a lot of adipose connective tissue surrounding it, and that is in the perirenal space. We could even see that perirenal space invades within the kidney, so into the hilum, in a region called the renal sinus. So that's the space through which the renal artery, renal veins, their branches and tributaries, renal pelvis, are all being conducted or communicated. Surrounding that will be the perirenal fascia, sometimes just called the renal fascia. And then between the perirenal fascia and peritoneum are the perirenal spaces, and these are quite variable. So the perirenal fascia divides the pararenal, external, from the perirenal space, internal. And if you ever get confused, perirenal is on the inside of the fascia. Now this perirenal fascia is like an inverted cone, and the base of that inverted cone is fairly high up, and the cone is going to encapsulate the kidney, the suprarenal gland, all of the conductive pathways of urine, the ureters, all the way down to the pelvic brim, where the apex of that cone will be. Individuals who experience rapid weight loss can sometimes also rapidly lose perirenal adipose tissue. That can be problematic because that adipose tissue within the perirenal space acts kind of like packing peanuts around the kidney. And when that is reduced, the kidney is more free to move within that space. And with respiration and with certainly the force of gravity, the kidney can be displaced inferiorly. And when that happens, sometimes the ureter might get kinked. Now, the act of displacement is a condition known as nephroptosis. It's a droopy kidney. And this can be very painful because the kink in the ureter can cause urine to build up within the kidney, and the kidney can swell a little because it has that extra pressure from within. Now, a really sort of simple way of diagnosing this is, does the problem resolve when the person lies flat? When you take away the force of gravity working upon it in an inferior relative to anatomical position direction, typically the kidney moves back into its more typical location with its hilum at L1. So let's assess the knowledge. Which fascial space most closely surrounds the kidney? Is it the perirenal space, the retroperitoneum, or the subperitoneum? Well, the whole space is retroperitoneum. Subperitoneum is below it in the pelvis, so we have to decide between pararenal and perirenal space. Well, we know that peri with an I is on the inside, so B is the correct answer. Thank you so much for your time, and I look forward to talking to you in the next video.